Greetings, salams, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Fazial MJ Suleman. We welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on the various audio streaming and channels and other platforms. Our topic for discussion is male health and prostate condition, and our guest this evening is Specialist Urologist Dr. Riaz Osman. Dr. Osman, Assalamu alaikum wa rahmatullahi wa barakatuh, and Jazakallah khair for joining me in the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh. Jazakallah for having me.
Absolute pleasure, Dr. Osman. Dr. Riaz Osman completed his MB CHB degree in 2002 and served his internship at the King Edward Hospital. He joined the Department of Urology in 2005 after completing his community service at the Prince Masheni Hospital, working in emergency medicine, general surgery and anesthetics. Dr. Osman has been part of the Department of Urology of KwaZulu-Natal for the past 18 years and is currently the acting clinical head of department at the St. Aidan's Urology Hospital as a specialist urologist. Dr. Osman also practices at the Capital and the City Hospitals, and soon will be practicing at the Parklands Hospital as well. Dr. Osman, just before we dive into our topic for discussion, I introduced you as a urologist. Just for my benefit, who or what is a urologist? What's his function?
Jazakallah. So basically, a lot of people get confused when they say, I'm looking for a urologist. They somehow get referred to me looking for a neurologist.
Okay.
So to put it crudely, essentially, a urologist, we handle the plumbing.
I was about to introduce you as a Minister of Waterworks, but I don't want to go there. So basically, you, as you say, you deal with the plumbing in the body.
Yes, exactly.
Okay.
So if you have any urinary symptoms, whether you have difficulty passing urine or you're going frequently, then basically we need to assess you and see what the cause is.
Mm-hmm.
And as I was telling you earlier on, the ultimate boss is the bladder.
Mm-hmm.
So whether it's 2 a.m. and you're in a deep sleep, you've got to get up and you've got to go.
Mm-hmm, mm-hmm, mm-hmm. So having said that, there's a condition called the lower urinary tract. That's I think you guys call it LUTS, lower urinary tract symptoms, and those symptoms are caused through prostatic enlargement.
So commonly in a male,
mm-hmm.
it's basically enlargement of the prostate that can cause these symptoms. That's the main cause why patients normally present, male patients present. But the symptoms that you can have can be a combination. So lower urinary tract symptoms is basically the bladder down to the outlet, which is the thin muscular tube, which is called the urethra. And essentially your symptoms could be irritative symptoms or obstructive symptoms. So irritative symptoms, we're looking at basically frequency where you need to go more often, nocturia, when you have to get up more than often in the evening, and then also you have the urge to go. So basically wherever you are, you're conscious and cognizant and aware of looking for where the nearest toilet is. And then in severe cases, you can end up with a situation where you end up with urge incontinence. So you have the urge to go, and unfortunately you can't make it to the toilet, so you might leak 1 or 2 droplets.
Did I hear you use the word incontinence?
Gee.
Can you explain that? What is incontinence, please?
Incontinence, involuntary leaking of urine from
mm-hmm.
the bladder.
Mm-hmm.
So essentially that depends on a multitude of causes, but when it affects patients socially, especially when you're in a public environment, and there's different types of incontinence, but essentially it depends on what your predominant cause is. So sometimes commonly you get a thing called stress incontinence. So that's induced by increase in your abdominal pressure. So if you cough, sneeze, you're lifting a heavy object, you can get that involuntary loss of urine. And then the other type, the most common one, is urge incontinence. So you've got a full bladder, you're trying to find a toilet, you're trying to get to a toilet and you don't get to a toilet in time, then you leak a little bit of urine.
Mm-hmm, mm-hmm. Now, we called it lower urinary tract symptoms. Basically, physically, what are those symptoms and what is the irritation that you're experiencing?
So the most common symptoms that you get, especially in men, is that you get a thing where you get the urge to go to the toilet. You get to the toilet, you're all settled and you're ready to go, and then nothing's happening. So that's hesitancy. So there's difficulty initiating your urine stream. And then once you get going, then you notice that, you know what, it's not coming out as free-flowing as I would like. So that is basically another characteristic where you have a weak stream. And then you can also get a progression of that symptom, which is called intermittency. So it stops and starts. And that's basically very debilitating in that way. And then once all of that is done, you get that feeling, that sensation where you haven't completely emptied your bladder. And there's something still residing within the bladder. We call that a post-void residual. And if you've got those symptoms, then you know, top of the list is you got to get assessed to see if you have a problem with your prostate.
Now, what causes this?
So in men, the most common cause of it is benign prostatic enlargement, to define it, and that's purely by the symptoms. It's commonly known as BPH, and by proper definition and terminology, BPH is benign prostatic hyperplasia, which is a histological diagnosis that's diagnosed in a lab. But benign prostatic enlargement is a benign growth of the prostate that can present with or without obstruction. And essentially, that is what causes the difficulty and causes the lower urinary tract symptoms.
Now, does this happen to people over a certain age or at a certain age, or is it across the board?
So it normally presents in elderly males, and it can present in younger males as well. So we're looking at over the age of 40. Let's say life begins at 40, and that's when you start being more cognizant of all your the gifts that you've been given, that now you've taken for granted, and you become more aware of it.
Absolutely. And is it a certain group of people that get it, or a certain demographic of a community that gets it? How does it work? Is it across the board?
It's generally across the board, but then there's also a familial predisposition as well, and it's also very easily confused. So the main reason that patients normally present to a urologist is when they have symptoms, or unless they have a concern of prostate cancer. So that is the only thing. So it's important to remember, if you have lower urinary tract symptoms, it does not necessarily mean that you have prostate cancer. You have a problem emptying your bladder, and the most common cause is your prostate.
Now, what do you call this now? Can you take any preventative measures for this?
There are medical therapy, and basically most of them haven't proven, with studies haven't shown significant benefit, but there is also a significant placebo effect, and a lot of patients do get symptom relief. But at the end of the day, you know, when patients present with these symptoms, we quantify it, and we use a symptom score, severity symptom scoring system. And that way we can see how debilitating these symptoms are, and is it really affecting the quality of life. And most of them can be managed without any medication or any need for any surgical intervention. And it's just about, you know, managing your fluid intake, managing your overall well-being, so that you can regulate your bladder to behave in a more appropriate way.
So besides management, is there any other treatment?
There are lots of treatments available. So essentially, depending on your severity of your symptoms, what we do is we look at it. Is it really affecting your quality of life? And then we do further testing. And we would, so your urologist would assess you. He would do a physical examination. He would consider doing an ultrasound. And one of the tests that we do as well is to basically look and quantify your urine flow. So the rate that you are able to void. And then we also rule out other causes. So we'd also look for any risk of prostate cancer, and we'd look for any other possible causes such as urinary infections, and if there is a significant amount of urine left behind in your bladder. So an ultrasound would give us all those key factors in there.
Just to remind our listeners that you're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa. We are discussing male health and prostate conditions, and this is an interactive program. You may forward towards your questions on or via WhatsApp on 060-904-1056. That's WhatsApp 060-904-1056. Our guest this evening is Dr. Riaz Osman, who is a specialist urologist, and we're discussing male health and prostate conditions. Now, Dr. Osman, you did mention that the treatment, there's various forms of treatment for this particular condition. And if you manage, is this condition, can it be cured, if I can put it that way?
Gee. So the thing is, with our general management, what we advise our patients is to see if your symptoms are not severe, we can put you on a thing called watchful waiting. And what we look is about educating the patient about the condition, reassurance, and then we look at periodic monitoring and see how the symptoms are. If they progressing. If they're progressing, then we would suggest, pharmacological treatment. So most patients do quite well with pharmacological treatment, which means it's just one tablet you take once a day and they have a good quality of life. But with any treatment, you need to be aware that there are side effects associated with it and something to be aware of. If you want definitive treatment, then a surgical procedure would be necessary if you want a complete resolution of your symptoms.
How successful is surgery?
So the success rate is almost over 90%. There are small risk factors associated with and commonly associated with any surgical procedure. There are newer therapies that have come out now that are called MIST, which is basically minimally invasive surgical therapies. And the main purpose of those procedures, especially in younger patient where they want to minimize their side effects, then that would be an option. But the gold standard of managing the prostate is a procedure called a TURP. A TURP is a transurethral resection of the prostate. So it's an endoscopic procedure to go and just shave off a little bit of the prostate. So mechanically, that obstruction that you're getting is basically relieved.
And should males over a particular age have themselves examined or tested over a period to ensure they don't have any of these conditions?
So it's advisable that you general health care, looking at men's health, is making sure that you're monitoring how your urine flow is, how your stool pattern is, how your libido is, what your weight is, and how that is behaving. And also monitoring the response, If you're presenting with any symptoms, you should get a full service. You can't be driving a car endlessly and not taking it for a regular checkup and a service. Absolutely. Make sure everything is in order. I think we actually give our cars more importance than our own bodies.
You couldn't have put it better. Definitely. Now, you used some terminology as well during our discussion. You spoke of irritative symptoms and obstructive symptoms.
Gee.
Now, what's the difference between those symptoms? And and how does the condition we're discussing, relate to these symptoms?
So, the most important thing on the scoring system that we use, we look at the whole global picture. And the global picture, what we're looking at, ultimately comes down to your quality of life. So if you've been going to the toilet, let's say 5 or 6 times in the evening, and if we can reduce that with lifestyle measures and you only go once or twice, that's a big gain. And then as for someone who's going to the toilet and he's having severe obstruction where he can't empty his bladder, is walking around constantly with a full bladder, he's having that discomfort, and then if he sits, stands, or he basically lifts a heavy weight and leaks, that's a significant impact on his quality of life. So it's a whole spectrum that we quantify and we see where the patient would benefit in terms of monitoring it with conservative management, medical therapy, or ultimately, if need be, a surgical procedure.
I got a WhatsApp message which came in. It just comes with 2 words and a question mark. Cranberry juice and question mark.
Okay. So I think it most likely is from a female patient.
This is cranberry juice and a question mark. Yeah.
So cranberry juice is it's a good natural remedy to take, especially for patients who have irritative symptoms, or normally in females who have an overactive bladder. So the benefit of that, there's an ingredient in grapeseed extract, which is an antioxidant, and it does help with bladder function, but it's a natural therapy. And if your symptoms don't improve with the cranberry therapy, then you need to get your condition investigated further to see if you need further therapy.
WhatsApp message from Brother Yusuf says, for prostatic enlargement, is prostate gland embolization treatment available in Durban, and how successful it is? Some medical aids don't pay for this procedure, and is it a costly procedure?
Okay, that's a good question. So prostate artery embolism is basically falls under the minimally invasive procedures. And I think there's a big misconception with prostate artery embolism because it's a new fad, I would say. But the research has shown that it is successful as equivalent of taking medical therapy. It is not equivalent to having a surgical procedure, which is a scraping of the prostate. And there's also a side effect associated with that, is that the amount of radiation exposure that you get from having this procedure is equivalent to a significant amount, almost, if I remember correctly, it's about almost 1,000 X-rays for a year. So that's the amount of radiation they expose you to. And the symptoms is equivalent to taking medical therapy.
Okay, so it is something that can be quite problematic, the side effects especially.
Exactly. So I think whatever modality you are investigating, it's always valuable to see what are the pros and the cons, and weigh it out yourself and have a discussion with your urologist to iron out all the possibilities so that you can make the best educated decision.
Thank you for that, Dr. Osman. 060-904-1056. We are discussing men's health and prostate conditions. You're welcome to forward to us your questions via WhatsApp, and Dr. Riaz Osman, our specialist urologist, will attempt to answer those questions. Now, just to remind you that doctors and guests on the Medical Files program will help you with any medical problems that you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio stations nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Dr. Osman, just before we take the ad break, I'm sure that this condition impacts on the quality of life, on hygiene, loss of sleep, etc. Do you just touch on that for us, please?
Yeah, so the main things that, with the effect of BPH or BPE, enlargement of the prostate, is that, hygiene becomes a problem, especially when you have that involuntary leak, and it's always a psychological stigma. Am I clean? Did I leak? And it becomes a problem, especially when you are planning to go for salah. A lot of my patients, those who are elderly, who sit and read salah, they do have that symptom, and it's debilitating in that you're always concerned, are you going to leak? And the thing is, if it progresses, you need to get it investigated to see how you can basically remedy the situation.
So it definitely has an impact on the quality of life. Also, what you call now is a hygiene problem. And what about loss of sleep?
Yeah, so the main symptom that the loss of sleep is the nocturia. But you must remember, in an elderly patient, it's not just a problem with the prostate. Most patients are either on an antihypertensive, they are on a diuretic for a cardiac problem. The antihypertensive might have diuretic effects. So what happens is that during the day, fluid accumulates in the lower parts of your body because you are on your feet, and when you go to bed in the evening, that fluid gets released and essentially gets absorbed and gets passed through your kidneys into your bladder. So fluid restriction is very important in order to balance that debilitating symptom at night, in the evening, of getting up frequently to go and void.
Dr. Osman, there's quite a few questions that have come in. But before I deal with the questions, maybe you can just discuss different types of therapies with us for Lutz.
All right. So basically, what we normally do, if a patient is not coping well with conservative therapy, then we offer them medical therapy. And the common form of medical therapy is a thing called an alpha blocker. And the alpha blocker basically works on the smooth muscle of the prostate. So just a bit of anatomy. The prostate is a gland which is found just below the bladder, which encases the urethra, which is the passage or the muscular tube that helps the urine to pass outside. So that tablet or that medical therapy essentially relaxes the smooth muscle of the prostate and helps with the urinary symptoms. There's also another therapy that we offer, which is called a 5-alpha reductase inhibitor. Basically, what this works on is on decreasing the size of the prostate. So in combination, these two tablets work very well. If a patient notices that they're not getting significant improvement, then we would advise them to basically look at a surgical procedure. In a younger male, the most common problem that we have is that these medications have side effects. And the main side effect with an alpha blocker essentially causes retrograde ejaculation. So if a gentleman hasn't completed his family and wants to preserve his ejaculatory function, then essentially this is the side effect of the tablet and most of the procedures that are done surgically to remedy the situation. So we offer these patients minimally invasive therapies which has a limited lifespan but preserves ejaculatory function. And those procedures are essentially, one of them which we mentioned earlier on was prostate artery embolization, but there are other ones where we basically, you can be done in the convenience of your rooms under local anesthetic, or can be done in theater under general anesthetic. So there's a multitude. There's essentially a microwave therapy, ablation therapy, and then essentially there's a new procedure that's on the market which is called Resume, which is high pressure steam which is injected into the prostate, and it causes shrinkage of the prostate, which helps basically with the urinary symptoms. And then there are also other forms, which is a Urolift procedure. The Urolift procedure is essentially what we do is we tack the inner part of the prostate to the outer part, and it mechanically opens up the prostatic opening so that the symptoms improve. But as I said, these are all short-lived and has a limited improvement in the quality of life and the symptoms. And essentially, the gold standard that we see is a transurethral resection of the prostate, which is a shaving of the prostate.
And this is a complicated procedure.
The resection of the prostate, yeah. So the thing is, with any surgical procedure, there are advantages and disadvantages, and one of the main disadvantages is that you lose that ejaculatory function. So if you haven't completed your family and you're going to preserve your ejaculation, then this is definitely not an option for you. But if you have completed your family and you're willing to do it, then under general anesthetic, the side effects are minimal.
Thank you for that, Dr. Osman. I see the questions are pouring in. From Mr. X says, Salams. I am a 67-year-old male, no chronic conditions, BP or diabetes, etc., only gouty arthritis. I did a PSA test in January 23 and it was within the range. As we know, med schemes allow only one test per year, but is this test frequency adequate though? That's my first question. Second question from the same listener. I was hematuric for about 4 decades, where the urologist did many tests and did not find any cause. So it was termed idiopathic hematuria, which has since disappeared. The third, I think the next is a question again, says, my GFR was low on last blood test, about 45, and is this a concern? And does internal hemorrhoids affect the prostate gland? Jazakallah. Sorry, quite a few questions. Quite a few questions from one listener, but I'm sure you can deal with them.
Okay.
Yeah.
So essentially, the follow-up in prostate cancer or the risk for prostate cancer, it depends on your age, depends on your family risk, and depends also on your demographics as well. So prostate cancer is more common in the African population, and if there's a familial predisposition, your chances are also increased. So the follow-up needs to be more closely, more more frequent. But if you have been completely assessed, then it's not necessary to have a prostate, a PSA done so frequently. But if you have been cleared, fully investigated, you can follow up with your general practitioner by doing an annual PSA.
Mm-hmm.
The second question is a little bit more confounded. So at the end of the day, idiopathic hematuria means that when a patient presents with hematuria, which is blood in the urine,
Mm-hmm.
it's a telltale sign that we have to be concerned and rule out the risk of any malignancy in the urogenital tract, especially from the kidneys, the bladder, or the prostate. So if you've been fully investigated and you had it over 4 decades, alhamdulillah, there's no reason to be concerned. It is a bit disconcerting to notice that the change in the color of your urine, but I think you can rest easy that there's no risk of any malignancy.
Mm-hmm.
And then the last question in terms of the hemorrhoids, must remember everything is interrelated in the pelvis. So especially with females, we tell them your next door neighbor is, so in the front of your body you have your bladder, your next door neighbor in a female is then your uterus, and behind that is your intestine or your bowel and your colon. So if you've got hemorrhoids, it can trigger, but it would not cause severe symptoms that would give you difficulty with your urinary symptoms. It can vary, but it is related because the nerve supply is close by. So if you have constipation means that your next door neighbor is not happy. So he's obviously going to irritate you, and that's why you need to make sure you have good bowel management, and also to make sure that your bladder is well regulated as well.
Thank you for that, Doctor. The next question: can an abscess in the bladder cause incontinence?
Definitely. So anything that causes an irritation or an abnormal situation in that environment can lead to urinary symptoms. And your urinary symptoms could be from pain, could be from dysuria, which is pain on voiding, and can also have storage symptoms where you could, when you have a full bladder, you could have bladder pain as well. But the main thing is that you need to monitor it so that you don't have a recurrence of that infection, and treat the cause, because the infection was definitely due to some other pathology.
Mm-hmm. Does DHT cause inflammation of prostate in old age? Kalunji oil has a naturally 5-alpha reductase inhibitor. Also, use some fancy terminology here. Thymokinine and derivatives that can shrink the prostate. Sorry, typing errors in the message.
Yeah.
So you got the gist of it.
I got the gist
okay.
of it. So essentially, what happens as a patient gets older, you get an increase in the DHT production, and that causes an increase in the size of the prostate cells, and that's what leads to benign prostatic enlargement. It's a mechanical obstruction because of the hypertrophy or the hyperplasia. So if you look at it on a histological diagnosis, it means that it's an increase in the size and the number of the cells. So in terms of Kalunji, alhamdulillah, Kalunji has a lot of benefits. Mm-hmm. I don't have any scientific evidence personally, but if you are getting benefit from it, I would say definitely continue with it. But the pharmacological management is 5-alpha reductase inhibitor, which there are a few medical therapies that give significant release, and how it works by decreasing the size of the prostate cells.
Good. They did mention that it can shrink the prostate.
Yeah, that's how it works.
Excellent. Monli, will you go to the next question there, please, for me? Not one below that. It says, Salams, if you're experiencing very strong odor urine, is there no connection to this prostate issues? Might be something else?
So hydration is very important. If you notice that if you're not drinking adequately, you're going to see the consistency of your urine changing. It's going to become more concentrated. If you have medical problems associated, if you're diabetic, and if you have a problem where you're not emptying your bladder adequately, when you do empty it, it can have a foul odor. And if you're diabetic and you're not emptying your bladder adequately, you're at increased risk of urinary infection. So it could be directly related to the prostate, but also you got to see what's causing it.
Salams, Doc, does 5 milligram, it's called Cialis, Cialis, help reduce the size of an enlarged prostate?
Yes, so there's new studies that have come out and shown that 5-phosphodiesterase inhibitors have a benefit on lower urinary tract symptoms associated with BPH. So it's a small percentage benefit, but it is an option. It has a dual benefit. It helps you in the bed, and also it helps you with your urinary symptoms as well.
Excellent. Salams, I think we just one down there. Thank you. Salams, Jazakallah khair for an informative show. Please advise diet after prostate surgery.
So alhamdulillah, if you've had your prostate surgery, specifically related to benign prostatic hypertrophy or hyperplasia, you don't need a specific diet, but essentially it's important to have a good overall diet plan and to make sure that you are preventing any other long-term problems in terms of your cardiovascular health, in terms of preventing metabolic syndrome where you are gaining excessive weight, and that can affect your hormonal function and can cause lead to erectile dysfunction. So it's more than just worrying about a specific diet geared to the prostate, but if you had your procedure, then your symptoms should be much better, and there's no specific dietary requirements, just a general overall good diet.
You're listening to Medical Files, and we are discussing male health and prostate conditions. Our guest is specialist urologist Dr. Riaz Osman. And Dr. Osman, the next question that comes through is, Salams, I am 50-year-old male. Urinating is fine, but I have a problem with erections and arousal. Only happened after the age of 45. Anonymous, Jazakallah.
Jazakallah for the question. Yeah, I think, you must remember, as I said, if you are driving a car for 50 years, you can't expect it to function as it was when it was 16 years old. So there's different changes that go on in your body. And one of the things is that you notice there's a thing called late onset hypogonadism. So as you age, then the pituitary gland does not produce the same amount of hormones that can stimulate the testicle, which produces testosterone. So there is a natural drop-off in your testosterone production. So it's always advisable to get to see your GP, do some baseline bloods, make sure that you don't have any comorbidities such as diabetes, high blood pressure, or cardiovascular disease, and then also to check your testosterone level and to see where you are sitting, and at the same time to get a PSA done as well.
Thank you. Salam, Doc. I'd like to know why I always feel wet after relieving myself. What is my problem? I'm not diabetic. Jazakallah. Interesting show. Alhamdulillah.
So alhamdulillah, that's a very common problem. And the thing is, as you get older, what happens is that when you void, there's a difference between a male urethra, which is the muscular tube that connects the bladder to the outside, and a female urethra. So the difference between the male urethra is much more longer, and it has a curved pathway to the outside. So what I normally advise my patients is that after voiding, while you are on the toilet, just reach underneath in the perineum, just underneath the testicles, and press on the midline. And there's about a ml of urine that sits in that reservoir and that curvature of the urethra. If you press on there, and if you press on the distal part or the end of the tip of the penis, that 1 ml of urine that sits there is completely removed, and that gives all my patients significant relief.
I go between 4 to 5 times a night. Do I have to worry about it? It's not bothering, and about 15 times in total for the day.
Okay, so by definition, going to the toilet more than once in the evening is abnormal. So you need to get a full investigation. Going to the toilet more than 15 times in a day is abnormal as well. So you need to get assessed. You need to ideally start off with your general practitioner, do a urine test, do a few blood tests, and see if there's anything that's correctable, rule out any signs, possibility of an infection. And then if there's no signs of infection, then it would be advisable to get to see a urologist. In terms of your medical conditions, you need to be aware of, you could be diabetic, and that's why you're going to the toilet so frequently.
For prostatic enlargement, is prostate gland embolization treatment available in Durban, and how successful is the treatment? Some medical aids don't pay for this procedure, and is it a costly procedure?
Yeah, I think we were discussing prostate artery embolism. It is available in Durban. It's not done by a urologist. It's done by an interventional radiologist. Some medical aids don't pay for it, and some will pay for it. But normally the reason being is because it's not the gold standard of therapy, and this is with international guidelines. In South Africa, we follow the European guidelines, but also in the American guidelines, which we follow as well, we see that it's not equivalent in terms of outcomes compared to the gold standard, which is a scraping of the prostate, also known as a TURP.
Salam's doc, does prostate massage help with prostate health, and why have doctors stopped this as a therapy? Comes from an anonymous.
Yeah, so I think this is a bit archaic in terms of this was designed originally for patients who had a thing called prostadenia. Prostadenia means painful prostate, and that was seen with patients who had a chronic infection of the prostate. It's outdated, and it has not shown any benefit. In fact, patients who have an active infection of the prostate, it's advised not to instrument, or if necessary, examine the prostate in the old school method of doing a rectal examination. So the best way to clear out any prostatic fluid secretions is by sexual stimulation and ejaculation.
Can high estrogen containing foods aggravate the prostate, BHP, cause inflammation and increase PSA levels?
So the study between the estrogen and testosterone relationship, there have been studies that have shown that in society we're being exposed to more estrogens, and that is having a compounded effect on overall men's health. So it's not just specific related to the prostate, but in overall men's health, decrease in libido and overall hormonal function has been proven. Can
5-alpha reductase inhibitors and alpha blockers both be used together for BPH? That is a tablet that relaxes and a tablet that shrinks the prostate.
Yes. So one of the tablets that we do give is a combination tablet, and it is basically a combination of a 5-alpha reductase inhibitor and an alpha blocker as well. The symptom relief with that is more significant as compared to taking either or alone. And the only thing you need to be aware of, to see full benefit from it, you have to take it for a minimum of 6 months to see the maximum benefit.
Sorry, man. I say the questions are just pouring in. I just need to decipher what we're going to be discussing. Now, when your prostate is enlarged, how do you feel? What are the symptoms? I mean, you did mention about the urinary tract, but are there any other symptoms that one experiences?
So there's no telltale sign specific. It's normally patients present with obstructive symptoms, so difficulty voiding, and as I mentioned, hesitancy, urgency, all of those symptoms. But the reality is that you could be walking around with a big prostate and be totally asymptomatic. So that's why, if you do have symptoms, don't sit on it. At least get to your GP. Make sure you don't have an infection. Make sure you're not diabetic. And then make sure you don't have an underlying cardiac problem or a kidney problem, and if need be, if it's related to the prostate, then it can be further investigated.
Salams, does taking Nebido increase prostate size, and is the generic available in South Africa? In India it's available, and its cost is minimal compared to South Africa. So
testosterone replacement therapy has a subset of patients who have confirmed hypogonadism, and one of the contraindications for giving a patient testosterone replacement therapy is if a patient has significant obstructive urinary symptoms related to BPH. There is a subset of patients who could be predisposed to going into acute urinary retention because of being on testosterone replacement therapy. Nebido is available in South Africa. I'm not aware of any generic at the moment, and I suppose once the patent is expired, then there would be generics available.
Okay, I think the next question we're going to answer privately, and we'll just send a direct message to the listener. What is the brand name of the combined 5 alpha reductase inhibitors and alpha blocker tablet. We'll send that privately to the listener that's sent us the question. Okay, I think you can open. We've read that. We've read that as well. Sorry, man. Okay, can natural diuretics such as dandelion tea, senna, stinging nettle help with BPH?
Yes, so those there's been a lot of research into natural homeopathic remedies, and these remedies have shown a significant relief in urinary symptoms, but it's not mainstream medical therapy. It's more of a placebo effect. And if your symptoms don't improve with those therapies, then I would suggest getting a full assessment and starting pharmacological therapy.
I didn't ask you $1 million question.
Gee.
That if one has some of the symptoms that you've mentioned during the program, who does one go to? I mean, I can't just run to a urologist. Do I first go and see my GP, or how does it work? Who do I go and see?
So it depends. It depends on the relationship of you have with your GP. These are all personal things, but majority of the general practitioners are more than comfortable in terms of identifying anything significant related to the urinary system. But I would suggest start off with your general practitioner, get assessed, and if it's something significant, then you can get referred to a urologist.
Salams, if one withholds going to the toilet on a regular basis, does this have an effect on his urinary tract?
So it's advisable that when your bladder gives you a sign, unless it's a dire situation where you can't go, then it's fine. But you got to look at it in terms of the long-term issues. Is that it can affect the function of the bladder. The bladder is a muscle. At the end of the day, if it is strained beyond a certain point, it can have long-term side effects. Mm-hmm. So it's always advisable. Try to avoid when suitable and when available, and not delay it.
Dr. Osman, I normally say time flies when you're having fun, but we've got like a minute to round up. I want to thank you for having joined me on the program this evening. Undoubtedly, it's been ultra informative. I'm sure you have a message for our listeners.
Jazakallah, I really appreciate the opportunity to come and educate and enlighten the population in terms of how to notice any signs of urinary symptoms, and I tried to keep this talk basically limited because urology is a vast scope. Mm-hmm. So at the end of the day, we've covered just the tip of the iceberg, but I hope that it's been of benefit to the listeners, and inshallah Allah grant all the listeners complete shifa with their problems. Ameen.
But you realize you just put your foot into it by saying we've just covered the tip of the iceberg. That means I've got to invite you again for another show. But Dr. Riaz Osman, Jazakallah Khair. And just a message from the Islamic Medical Association that they have a vacancy for a marketing assistant. Experienced marketing assistants required for an NGO. Experience is an advantage. Must have knowledge of social media, website, brochure compilation, newsletter, events coordination. Has to be a people's person, self-motivated, use initiative, results-driven, able to work without supervision, communication skills essential, able to work with other employees. Send a 2-page CV to IMAKZN. That's IMAKZN at Baytulnur, BAYTULNUR.org.za, or you can call 031-209-783. That's Islamic Medical Association of South Africa, the Durban offices. Time for me to wish you farewell. I want to thank all the engineers at the various radio stations who have engineered this evening, and thank the Islamic Medical Association for having produced this program. For myself, Fazial MJ Suleman, until we meet again, Assalamu alaikum wa rahmatullahi wa barakatuh.